good afternoon or good morning, depending on where you are. My name is Gil Rogers. I head up marketing here at Immersify Education. I am excited to welcome you to our webinar today, Beyond the Buzzword, Rethinking Technology as a Catalyst for Curriculum Transformation in Dental Education. I am not one of the subject matter experts. I'm simply the logistics and AV guy. I'm excited to be turning over the rest to Chloe here in a moment, but just for you all, for your knowledge and insight, we are recording this webinar and we'll make it available to you shortly after the conclusion of the presentation today. It's going to be in a type of fireside chat panel type conversation format. So we're not going to have any slides to send you, any of those sorts of resources, but we're going to have tons of great insights and tons of great conversation to share. So we're really excited about that. If you are so bold and want to share where you're from in the chat is open for participating and having a conversation throughout the presentation today. We also have Q&A open. So if you want to use the Q&A tool to send us any questions that you might have, we'll be collecting those throughout and finding times to answer them either during or at the end of the conversation. But with that, I'm going to turn this over to Chloe Barrett, who's the founder and CEO of Immersify Education, who is going to lead the conversation today. So Chloe, to you.
Thank you, Gil. Thank you so much. I'm really excited to be here with our amazing panelists today. Thank you all for joining, and thank you so much to our panelists. So today we have the pleasure of being joined by Dr. JoAnn Gurenlian and also Dr. Brett Kessler. I will just hand it over to them to give everyone just a brief introduction to their role and their experience in dentistry and in education before we kick off with the questions. JoAnn, I'll pass it to you.
Thank you so much, Chloe, and it's a pleasure to be here with everyone. And I'm looking in the chat and I see some of my former students and colleagues, so this is great to have you participate today. I am Dr. JoAnn Gurenlian. I'm the Director of Education, Research, and Advocacy for the American Dental Hygienists Association, but I've also been a longstanding faculty member, and I am presently an adjunct faculty member in the Department of Dental Hygiene at Idaho State University, where I teach oral pathology and also work with our graduate students on their thesis research. I am proud to say that I have a half a century of experience working in dental hygiene education, all of which has been exceptional. I know that, when I started out, learning was very different to what it is today. We had, a strong focus on pedagogy, and we also used limited technology at that time. Think back to if any of you ever used or had your instructor use an overhead transparency, all the way now to today, where we are talking about artificial intelligence and helping to support our students' learning. So there's a vast array of experience for us. We know that our students are different learners based on generations, and it's all exciting to me to see this. I think one of the best things about being involved in education is you're constantly learning something, and how you translate that information to students to support their learning is also a critical piece. So I'm really thrilled to have an opportunity to have this conversation with you, Chloe, and with Brett, and let's see where it goes.
Thank you, JoAnn. That's amazing. Brett?
Hey, thank you, Chloe. JoAnn, I was doing the math in my head at half a century of teaching. It doesn't work out when you're 35 years old. But wow, what a great amount of experience you have in teaching. I'm Brett Kessler. I'm the president of the American Dental Association. I used to be a clinical adjunct professor at University of Colorado School of Dental Medicine, as well as an associate's dean's faculty at University of Michigan School of Dental Medicine in the hospital. And this year, I guess the last year and a half as president-elect and this year as president, I've been traveling around the country and visiting several dozen dental schools and hearing the the education philosophies, and then getting to see the facilities and the different technologies that they're utilizing within their education domain. It's just fascinating to me, the vast array of things that how they're using the technology. And it's a really exciting time, not only to be in dental education, but to be a young dentist or a new dentist, getting to be able to exploit all of this technology in your practices as you grow. So I'm really excited to our conversation today.
Great. Thank you so much, Brett. So just to kick us off with the first question, we have a series of questions, then we'll go to some Q&A as well at the end. So the first topic that we'll dive into first is the current curriculum challenge. So let's start with the reality that many schools face. Technology is often seen as just another thing. Why do you think that is? I'll hand that to JoAnn first. Thank you.
Thank you, Chloe. One of the things that I think is really important for us to remember is that our curriculum is jam-packed with information, and it is complicated by the fact that we are working to make sure that we achieve the Commission on Dental Accreditation, or CODA standards, for our learning. And so in some respects, part of what we have is a very structured, rigid curriculum that is complicated when we find that there's new things that we have to learn, and we have to figure out, where are we putting that in the curriculum? How are the students going to learn? We're always adding on with limited opportunities to take away. And we make assumptions about the students and our faculty, one of which is we're tech savvy. I'm not tech savvy. I'm here on Zoom and I know what I'm doing, but I mean, I'm not that individual who has necessarily a command of technology. And I think there are many faculty who feel that way, as well as students. One of the biggest surprises for me this year was that my students were not as excited about technology as I thought they would be. They want to learn the information, but they weren't as engaged and focused on the use of different technology. And through the COVID era, I think we had a whole different learning environment for our students, and we did everything we could online to engage them. And some students really enjoy that because it's their personality and their nature to be engaging, but other students held back and weren't as enamored by that. So I think, we have to look at, how do students perceive learning to be? First of all, is learning demand? Is it an excitement? Is it a joy? Is it something to dread? And you have to balance all of those perspectives about what learning is. So we're always looking at ways to enhance learning. We're always looking at ways to provide accurate information to our students, but in a way that will stay with them, because the whole point of their education is that they implement that in practice. And they are then educators for their patients. So how we manage this, these are, some issues, how students will value technology and not be afraid of it, and how they will use it. Same thing for faculty, is really a constant for us who are educators.
Yeah, absolutely. No, thanks so much, JoAnn. And just a small follow-up question to that really insightful feedback is, in regards to students maybe feeling like they don't want to use as much technology, or do you feel that potentially there is sometimes too much, in terms of actually what works and what doesn't work? I know we've seen it, of course, at Immersify with different schools we work with, or we see where maybe there is too many segmented tools and too many segmented technology enabled platforms, where actually you may just need to use one or two of those rather than too many. I know that's definitely some feedback we've had, which has been really insightful.
I think there are times where we get excited about what's available to us, and we want to incorporate as many things as possible without necessarily reflecting about the value of that and the impact it will have on students. And students are stressed to the max Doesn't matter if you're in dental school or dental hygiene school, you're stressed trying to learn all this information and pass boards and everything else, and all those process exams that occur in a clinical setting. So I think there are times where we might have a little bit of overkill and need to pull back and find the tools that are really the most supportive for the students. Again, student attitude is important too. And if they come with the attitude, just tell me what I need to know, that's very different than a student who says, I want to understand this so that I can use this in my life.
Yeah, absolutely. Thank you so much for that feedback. Brett, any
You know,
thoughts?
I'm also been around long enough to remember my first presentations in the late 90s. I used to have to carry around a little slide reel with my slides that I put in there that were actually film slides that were projected. And then that went to PowerPoint, and, you know, and then mid 2000s, you know, and I would present these to students and they'd all be very engaged, eye contact, everything like that. And kind of mid 2000s, all of a sudden they had computers open in front of them. And it was kind of offended as a presenter at that point, because are they paying attention to me? Are they surfing the web? And, you know, and then it came to Dr. Kessler, we'd like to have your presentation prior to your presentation so that the students could come and be ready for it. But that turned into that they didn't come. They just watched or just looked at my slides. And so I stopped doing that. But how do the students learn today compared to how they did 20 years ago, 30 years ago? It's much different. And we have to meet them where they're at. Okay. And, you know, dental schools are in a crisis right now, fighting for faculty. Dental hygiene schools, same thing with the accreditations that are put in place, the requirements. And we have to find ways to get the information to our students so that they can assimilate it into their ability to practice. And so I view technology as a huge tool to help with solving that problem. And I think using artificial intelligence or augmented intelligence even will be an even bigger accelerator as we move forward.
Absolutely. Yeah, that's a brilliant point in terms of um, meeting the students where they're at. I think that's a huge impactful point to be made, because actually, as mentioned, we know this, that's why we're having this conversation, is students are changing in the way they're learning differently. So how can we accommodate that but not overwhelm them, to JoAnn's point as well? So it's really, how do we get the good mix of being able to embed technology for good, but equally meet them where they are and where they're happy to engage as well. So thank you both for that really insightful feedback. So just on to the next question. So if we think about the reframe of technology as a support layer, so let's talk more around the also like what's working. So real world integration examples. So could you both please share an example of where you've seen technology meaningfully integrated in the dental or dental hygiene programs?
Yeah, I can start. I love the schools that are really aggressively embracing these technologies, and some schools are completely digital. They don't, you know, there's not a lab with plaster in it, and watching, you know, the students scan teeth and then treatment plan and move teeth around, and watching, you know, the programs do it for them as a, you know, as options, or, you know, when they're scanning their preps, and then, you know, they're tracing their little their margins on their preps, and then AI is helping to design the design of the occlusal table, and or even the haptic simulations that we can do with, you know, where it's it's totally virtual, but it feels just like a handpiece, and it feels like you're cutting teeth. And when you go into the pulp, it drops in like the pulp. And so all of these technologies are giving our students reps and a varied experience that they can leverage, that I think is I think way more fun as a student than what you or I might have had. And very excited to watch them and use them.
Yeah, it's
I'm
great.
going to jump in and add to this too, because I think the simulations has really revolutionized the way that students are learning. And if there are sim labs available to students, I think it's tremendously helpful. And I'll give you an example of that. A while ago, I taught a medical emergency course, and we partnered with the nursing department, and we had our students work together and do some interprofessional work. And they were actually working on patients, well, sim patients who had medical emergencies. And it was really interesting to see the students' responses, because we never know when an emergency will occur. So everything was just on the spot education for the students. And I loved it when the student's patient died, and they just would be aghast. I don't know what to do now. I don't know what I did wrong. It was perfect opportunity to talk about, how do we implement emergency care? We know this happens, and how do we respond so that we're not like a deer caught in headlights? So simulations are fabulous for all the things that Brett said, but also for teaching certain other courses as well. And I think one of the other things that is really an innovative concept is the flipped classroom, because believe me, I do not want to lecture my students for 3 hours. I mean, that is not something you're constantly having to keep your energy up, right? To manage learning in a 3 hour slot. But at the same point in time, students have to understand their responsibility for their learning. And so when you can flip the classroom and use case studies and have them utilize technology to showcase their learning, that is really a wonderful way to help students bridge that gap between the traditional learning modes and some of the newer learning modes using technology. I do think it fosters more critical thinking, more collaboration, greater understanding. All of these things are good things to bring forward for our students.
Absolutely.
JoAnn,
Yeah.
there was a quick question in the questions about a flipped classroom. Can you talk about that more?
Sure. So in a flipped classroom, it's very similar to something Brett said earlier. Instead of doing those PowerPoint presentations and having the students go, well, can I have a copy of your slides, and then not show up at all, or do all your online shopping while your instructor is teaching? It's an opportunity for the students to have learned some of the information in advance. They study, they come prepared, and then there are learning activities where they're demonstrating their understanding and their knowledge, and where there might be gaps. It's an opportunity to go from the lowest level of Bloom's taxonomy, if you will, where we're identifying something and explaining something, to really advancing concepts to higher level thinking. I think it's really a great opportunity, because there's less stress on me to be, like I said, lecturing for an extended period of time, and greater opportunity for student collaboration and learning together from each other.
Yeah, amazing. Thank you so much for that explanation as well, John. As soon as you said flip classroom, I was like, yes, like this is where we need to be, as we need to be teaching in this way. It's flip classroom has been it's been happening for a long time, but actually really it's only now just taking more. I know, John, you've been doing it for some time as well, and I think more and more people are becoming aware of the benefits of a flip classroom, and not too worried about, actually, am I going to not just do a traditional lecture? Am I really, is this going to really be a benefit? And absolutely, we see many, many white papers and lots of research on the flipped classroom. And if you can, as you mentioned, I think thinking that in alignment with the attention span of, they say 10 to 15 minutes, we'd probably all agree more like 5 to 8 minutes, if not less. So actually, if you can And I think we're all like this now, even not even just students. I think we all want instant information. We want it bite-sized. We want to be able to digest it in a manner that we want to digest it. So yeah, I love that you touched on the classroom, because that is absolutely an amazing approach to take when looking to embed technology. How do we embed technologies that can also support the flipped classroom, and of course complement that approach as well? So yeah, thank you both. Really, really valuable insights. So now I'm going to go on to a question about from resilience to buy-in. So that keyword resilience is an interesting one. And so as we know, even with the great tools, it's hard to change. And I think especially in education. So thinking around faculty engagement and faculty changing in terms of, embedding technologies, looking at how they can use technology. I think with faculty feeling stretched too thin as well, which, as you mentioned earlier, JoAnn, that is happening, and faculty, lack of staff. So I suppose, what have you seen that helps shift mindsets within, programs? And yeah, it'd be great to understand what experience you both have within this area. I'll hand it to you first, JoAnn, sorry, and
Okay,
then
all righty.
Go ahead.
So I just was working on a study with one of our graduate students, looking at technology and how educators are impacted by technology. And one of the things that we saw was really a widespread gamut in how faculty embrace technology. And I can't say that it's age related, because we had some young, newer faculty who just were not interested in technology. So that was a really surprise. That was a surprise for us. Not everyone is like that, but I think what came through in the study is that all faculty want training and professional development in the use of various technology. I think there's this expectation that as faculty, we just know, right? We just know what to do and how to do it. And that's not true. We need to learn new skills just like everybody learns new skills. And so having that faculty development and even peer-to-peer training really is helpful, to then start to see how do you want to change that landscape of learning for your students. We know that the curriculum is as packed as it could possibly be. There's limited time to, experiment with new things, but at the same point in time, we are trying to recognize that we can be resilient and we can learn something new, and that embracing the newness of something allows us to be more creative and innovative. So I see a lot of benefits for that. I will tell you that I've tried many different things. Some of my students love when we play games, and other students find that to be frivolous. Some students, want to do something, want to try something new, but other students are afraid of it. And they're just like the rest of us. We're afraid of something that's new and we don't have experience with. But what I think is the challenge for all of us is to keep an open mind as educators and even as students, to try to help them do something that is a little bit different. And I know for myself, when I'm trying these new opportunities, many times it requires a tremendous amount of work on my part to create something. I look for a learning tool that already has something created, that I don't have to be the inventor of all the examples that are being used. And it's partly why I really enjoyed looking at Immersify so much, because I do think it gives students those short bursts of learning opportunities without being bored, but also, fitting what is useful and effective for them. And it's a great tool for me because I'm not having to, create everything on the spot. So I love all of these features that we're talking about. And it's exciting to see when something new comes out, how can I apply that for student learning?
Right. And they get to do it on their own time. And, they may be introduced it as a group, but then they can go, repeat, go deeper into the program on their own journey so they can assimilate the information. And, you know, and the schools that I've been to that were, you know, the most embracing of the digital technology, and they all are, some more so quicker than others, absolutely. But the ones that have gone all in, they're attracting a faculty base that may not be experts in this digital technology, but they're so ready to learn about it and become, you know, calibrated on, you know, how these programs work and how they can leverage the teaching of the students. And, you know, and JoAnn, a couple of minutes ago, you talked about critical thinking as one of the, you know, the most important things as a, you know, as a healthcare provider, as a doctor, as a hygienist. You know, we have to be able to think critically. We have access to, you know, to information right here. I do not need to memorize how many molecules of ATP happen in every Krebs cycle. Okay. And I don't need an hour lecture on that and then be able to memorize it and then, you know, and regurgitate it on a test, because I can access it here. What I can't access here is how to think critically. And these technologies really leverage that to make you think bigger than just regurgitating the information. How does that assimilate with the patient's health history? How, you know, what happens when something, you know, doesn't go quite as, you know, like what you said in the simulation death of your patients, you know, how do you learn from that? In the real world, if someone died on you, you don't get a second chance on that, right? But you can experience it through repetition and trial and error. And you'll never forget it because it becomes an experiential learning as opposed to a memorization or rote memorization type learning.
Absolutely. So, yeah, I couldn't agree more. Absolutely. And that's it. I think as you mentioned, Brett, in regards to that engagement piece, and you know, we want to be able to find the correct information as well. And I think it's critical that these platforms are able to, yeah, bring that information that's quality, high quality, enables that critical thinking, and fail safely, as we say as well. If we
Right.
can fail safely in an environment using the right technologies, then we are absolutely preparing the students and supporting professionals, of course, to be the best they can be and feel confident in those real life scenarios, which that's what we're here to do as well, as you mentioned. So yeah, really brilliant. Thank you so much. So as well, I think one of the other, I suppose, takeouts, I suppose one of the other takeaways, I just noted down as well on your both of you giving feedback on that, is that actually, you know, we see the improved buy-in from faculty, but it's actually how how we how we bring the faculty on that journey with us and how we ultimately integrate that into curricula. So not just being told to use something, how do we actually involve them in that decision making of actually this supports the curriculum in this way, or this supports the flipped classroom in this way. We see that a lot with our educational institutional partners, is if they're involved in some of the process, it absolutely supports the adoption and the understanding of it. So yeah, thank you so much. So we head into our next topic, which is student success. So this is where the outcome really matters. So let's connect the dots. How does thoughtful technology integration contribute to students' persistence and degree completion? I will hand that over to Brett first.
Okay, thank you. You know, like I said, everybody learns differently. And so, you know, utilizing this technology and then digging in on your own time to learn it is a great way for our students to find the information and be able to assimilate into their brain. You know, wellness is very important to me, and we're seeing a high level of burnout in this profession, and I see it especially in dental schools because these are the smartest of the smart, and you know, and I always say that they're smarter than medical students because they were smart enough not to go to medical school. Okay, they are, you know, they're going after dentistry because they really want to make a difference in that way, but they're stressed. And the easier they can learn things, the easier it is for them to deal with their stresses. And I always share with the dental students that I work with that, because they're really, this is so hard, they don't know what they're supposed to do. And I'm just like, you know what, if it were easy, everyone would be a dentist, everyone would be a hygienist. It's hard for a reason, because it's very technical, but you will learn it. The idea of perfectionism has to be put to side, and recognize that you're a neophyte here. You're not expected to be perfect. You're expected to be on a growth curve, and this technology will help you with your growth curve as as you progress through dental school, and then as you progress as a dentist or a dental hygiene school, or as a dental hygienist. And so it gives them a little more grace, where when I was in school, and maybe JoAnn, when you were in school, it was, you had one chance at it. Hopefully you took good notes, or hopefully someone in the class took good notes. And then you had to rely upon someone's, your memory or someone else's memory, or maybe the fact that the instructor didn't communicate things well. God forbid that ever happens, but it happened all the time. And so this is a way that can standardize the learning environment, and they can learn it on their own terms, in ways that make them feel good and not push them down.
I'm going to jump in here and support what Brett is saying, because I think we have some of the highest levels of anxiety and depression among our dental hygiene and dental students that we've ever seen before. And I think that students need learning tools that make them feel successful, that reduce that learning angst, that allows them to see that they are making progress, that they can track their progress, that learning tools can be intuitive, and be supportive. It doesn't have to always be that you're trying to fight technology. Like, this is an opportunity to work with technology and to enhance your learning. So I think there's something about having a learning tool that is supportive of students and helps to address some of that worry about, do I really understand this? Can I take a test and pass it? Can I demonstrate my knowledge? As Brett said years ago, it was all about how well your memory worked on a given day when you were taking a test, right? Very different than what we are experiencing now with our students, and trying to, provide those supportive and adaptive technologies that relieve some of that stress and worry.
I do have to say, I was with some dental students in Florida this past week, and the Florida Dental Convention, and and there were representatives from the different Florida schools there, and and some were expressing angst that they wanted to play more with some of the AI technology, especially around radiographs and things. And I said, I think you'll get your time, but we need you to learn how to diagnose it first, so you can tell if this technology is actually enhancing your diagnosis, or it's doing the job for you. Because ultimately, you as the practitioner are responsible for every aspect of that patient care. I don't care what tools you decide to use or not decide to use, it's on you, and you must have that basic understanding of how to do it. And so give yourself a little bit of grace. You will have plenty of time to play with the new toys, but you need to learn how to diagnose it first.
Yeah, that's so important, absolutely. And I think adding that confidence piece in, I think there's what you both mentioned in terms of the areas of that engagement with students, anxiety, but actually how can we increase the confidence, especially maybe preclinical and earlier years? How do we make sure they feel very confident with the information they've been given? And as you mentioned, not just passing a test, not just passing an exam, actually feeling confident moving into clinic as well. And I think throughout, how can we help build that confidence? Because I think that then helps with that anxiety and that pressure and that stress, because they already feel they have the right information around them to really feel confident. Thank you both. That was amazing. So on to our final question before we hit the Q&As for the audience. So looking ahead, what schools should be asking? I think there's so many questions that I suppose schools think about when thinking about embedding technology, adopting, integrating, thinking about what platforms are out there, how do they measure that, how do they assess it? I think that's also a big question that's being asked. And so I would like to ask you both, if you were advising, whether that be a dean or curriculum committee right now, what would be the top 2 to 3 questions that they should be asking about technology as they redesign? So if they're going to go through any curriculum changes or just embrace technology into their programs, what do you think they should be looking for?
You want to go first? I can go first, whatever. Okay.
And yeah. I guess for
Go ahead.
me,
Yeah.
I'll jump in first, Brett. I get this all the time. What will it cost? What's the cost of adding this technology, this tool, anything to our program? Is it readily available? Can all students access it? So those would be a couple of things that would be top of mind. How are we measuring the success of this? Is it by grades, or is there some other performance measures that we would be looking at? And what are the whole hangups? What's the barriers here? So, does this help address barriers to learning, or are there other barriers to incorporating this technology that we need to address? Because if we're going to be successful, we have to look at all of the aspects of it. So over to you, Brett.
Yeah, from not being immersed in education, coming from a completely different perspective, I'm like, oh yeah, you probably should have a business plan around this, right? How much is going to cost and what's the outcomes? But my first thought was, how will it enhance the student's experience in learning the information needed? Okay, and then how will it enhance patient care while they're students or residents of my programs? And then third, will it teach these young once they're out of their schools and out of their training, will it be something they can carry forward and teach them to stay on a growing trajectory throughout their career? Because the dentist or hygienist they are when they first graduate is nothing compared to what they are 5-6 years down the road, and they need to keep growing. And how can they keep using adjuncts like these technologies to project their growth?
Absolutely. Yeah, couldn't agree more. And let's say I think it's as you both mentioned, I think it's a couple of key questions, but I like both your inputs are so valid in terms of what maybe an overall institution be thinking, university, school be thinking in terms of the business plan thing. So there's so many elements that need to be thought about, but equally it does go down to student success as well. How successful is this going to be for students and faculty? And as mentioned, there's different assessment points. But yeah, really, really insightful. Thank you both so much. That was really, really great. So we've come to the end of the questions. I'd love to open the floor up to the audience. As they're typing, we do have a couple of questions that came through, so I'll just rattle through a couple of those while we hopefully grab some more from the audience. We probably just have time for 1 or 2 more. So if anyone has any, please add them in. But in the meantime, I'd like to just ask a question in regards to how do we ensure technology doesn't widen the gap for under-resourced students? JoAnn, do you want to kick us off with that one?
Sure. I mentioned this a little bit earlier. I think equity is really important for all of our students, and it may be surprising to us because we do all have cell phones, right? But that doesn't mean we have iPads or computers. We like to think everyone does, like who doesn't, right? But at the same point in time, there are students who struggle to have all of the technology demands available to them while they are in a dental hygiene or a dental program. And I think we have to look at, anytime we're looking at this technology, is how accessible is it? I know that with Immersify, you can use your phone. I do it all the time. I'm playing with that on my phone. And I think that is something that's more readily available. Not everything has that capacity. And there are some learning tools where even if you try to use your phone, you're not able to access all of that information because of whatever the technology is associated with it. I want students to feel that they have opportunities to have inclusive education. So that may be another reason why we want to design some of our classroom experiences so that there are group activities and there are opportunities for students to share technology with each other. I don't know if I hit everything there, Chloe, but those were just some initial thoughts.
Oh, that's
And I
great.
would follow up by saying, just as, when I was in dental school, I had to buy my dental kit with all the tools that I needed. An iPad and a computer is a tool that I need to get through dental school, and it needs to be part of, of whatever else you need to buy or rent. That should be, this is absolutely invaluable to your learning. So I don't care where you're coming from or how much money your parents have or how many student loans you can get. This should be part of your toolkit.
Yeah, absolutely. No, really great. Thank you both. I have a question from the audience, a new one that's come through. So many of the faculty have their own slides, so old slides. How do schools encourage them to use the new technology? So how do we take away sort of older slides, older use of old information as such, and then embed new technology? Brett, I'll put this to you first. Thanks.
So I think that it comes from leadership, and it's going to dictate what do we as leaders expect from you as faculty. Okay, and it has to be from the beginning to the end. And I've seen a great shift of dental schools away from the hobby instructors, the hobby professors who are just they've practiced for 30 years or 40 years, and now they want to give back a half a day a week, and they're going to come in and tell you, well, I know they're supposed to teach you this way, but I'm going to tell you how I do it, and this is the real way. I mean, that's kind of thing. So it has to be coordinated, and everyone needs to be calibrated to what's expected of them as an instructor, professor, whatever, as part of that curriculum, as part of that school.
I'm going to jump in also and say, when I was a former program director, I used to ask the faculty to throw out their course materials every 2 to 3 years. I'm sure they just so enjoyed my perspective on this. But at the same point in time, what I didn't want to have happen is that they would just change the date of their, course syllabus and do everything that they had been doing for 10 and 15 and 20 years. The challenge that I had for them is to be different, to learn something themselves, to bring it to the class session. And I think that's another way of inspiring individuals to embrace something new, embrace new technology, embrace new learning concepts, embrace something, but not be the same person you were 20 years ago trying to teach students now.
Yeah, I couldn't agree more. Brilliant feedback, and yeah, I'm sure you got a good reaction with that, JoAnn. But absolutely the right thing to do. I wouldn't want to be a fly on the wall, would I? But no, thank you. It's really, really insightful. So final question, what advice do you have for junior faculty interested in experimenting with technology in their courses? I know we've already touched on this slightly in terms of maybe looking for different technologies, but is there anything, anything you would suggest that they look for? JoAnn, I'll start with you.
Oh, I would be thrilled if junior faculty wanted to experiment with technology because I think that is a great way for everyone to learn something. And like I said before, faculty development and training are key aspects of this, and we can learn from each other. So if somebody's excited about a new learning technology, whether it's Immersify or flipped classrooms or case studies or whatever it may be, I think that's a great opportunity for us to have faculty meetings where we talk about those things, that new technology we're bringing, how we see it being applied, how we can calibrate each other so that we're all on the same page as we move forward. that is amazing. So I don't care how experienced you are, but I love it when a new faculty member comes in and says, how about if we do this? I think the worst words of the English language are, this is the way we've always done it. So if we can move away from that, and encourage that experimentation and that excitement to learn something or bring something new to the table, we should embrace it.
And I would also say that technology is evolving so quickly. Every month there's new things coming out, and I would, as a junior faculty, I would be talking to these companies and finding out about their products, and then asking to be a beta tester for their classes, and then get students involved with the research projects on outcomes about validity of this new technology. And do their own research, obviously, but then see how it works within in the learning environment. I think that's an exciting opportunity. Investments are investing in AI at a much greater level than investors were investing in the internet back in the 90s. Okay, this is the future, and it's moving so quickly. Get on, pick something, play with it, move on, or use it more and more and more, or move on and switch, because there's so many cool things coming out.
Amazing. Thank you. Thank you so much. We'll leave it there. I'll just provide a quick summary of where I think we landed on some of these key points. Of course, there was so much in terms of amazing insights and feedback from both of you. So thank you so much. I would probably just wrap it up and summarize that, technology should support and not be stressful. I think we need to embrace it and not push it away and resist it. Integration works best when it's intentionally and also faculty are informed. We really want educators to be coming on this journey with us and discovering these new technologies and seeing what works rather than, again, being resistant to it. Student success is the end goal. So I think a lot we've talked about here is how do we ensure that student success is at the heart of everything we're doing in education, because it really is. And so how do we set them up to be the best professionals they can be? But of course, this needs to also be with the right tools that can help them get there faster and obviously more confidently and efficiently. So yeah, there's sort of the three highlighted. Of course, we've got so many amazing golden nuggets that you both shared. So I just want to say thank you so much for your time. Yeah, really, really insightful. I'm sure everyone will share the same view on how amazing it was to hear both of your inputs. Before we close out, I just wanted to mention to everyone in the audience as well that from July, we have a first of our series of educational mythology courses. So what these educational mythology courses are, they are 30 minutes digestible on the demand workshops, and they're focused on integrating technology into the curriculum. They're also featuring real world case studies and insights from industry experts and peers. So really informative educational mythology courses that will be coming next month. So if you're interested, we do have a poll up now. If you'd like to have more information or sign up to any of these short webinars, please respond to the poll now so then we can send information out to where relevant. So thank you so much, Brett and JoAnn. It's been absolutely amazing to have you both on. I've absolutely loved talking to you both about and getting, of course, your amazing points on all these different areas and different topics. So just want to say thank you so much for joining us. And yeah, everyone have an amazing rest of the day, evening, morning, wherever that is in your time zone. But thank you very much, everyone, for joining us as well.
Thanks, everyone. Appreciate this,
Thank you
Chloe.
so much.
Thank you so
Bye,
much.
JoAnn.
Great working with you all.
Yeah, you too. Thanks so much.